All right, welcome. If you're an international medical graduate and you've been dreaming about a career in the fast-paced, high-stakes world of UK emergency medicine, then you are in exactly the right place. We're about to map out the entire journey for you, from those very first steps all the way to becoming a consultant.
And our guide on this journey is none other than Dr. Abdullah Farook. Now, he's not just an expert, he's a trailblazer. He has walked this exact path, coming all the way from Bangladesh to become a leading consultant right here in the UK. So his experience, it's the foundation for everything we're about to cover. And that is the million-dollar question, isn't it? It's a journey for sure, and it's filled with challenges. We're talking exams, visas, adapting to a completely new culture. But, and this is the important part, it is an achievable quest, and we're going to break down every single step for you.
Okay, let's dive right in. Before we even get to the paperwork and the practicalities, let's talk about the why. Why choose one of the most demanding specialties out there in one of the world's most unique healthcare systems? What's the real motivation here?
Well, the appeal is massive. The NHS offers this incredibly high-quality, structured training that's guided by the Royal College. You're going to see a diversity of patients and illnesses that you just won't find anywhere else. And, believe it or not, the shift-based system can actually offer a better work-life balance than a lot of other specialties, all while you're earning qualifications that are recognized and respected all over the globe.
And this just brilliantly illustrates the potential. Dr. Farook's own story started back in medical school in Bangladesh, really fueled by a mission to prevent unnecessary deaths. He got experience across 3 different continents. And then, get this, in the UK, he achieved something incredible. He passed all 3 parts of the big MRCEM exams in just 6 months while working full-time. He is living, breathing proof of what is possible. All right, so you're inspired. You're ready to go. So what are the first practical steps? Let's get down to the foundational paperwork that every single IMG has to conquer to even get started. You can think of it as 3 essential pillars. First, you need your license to practice from the General Medical Council, that's the GMC. Second, you've got to prove your English proficiency. And third, once you have a job offer, you secure your visa to work in the UK. You see? Every step builds on the last one. Now, for that English test, you have 2 main options. And what's really interesting here is the difference in focus. IELTS is a general academic test, right? You're doing essays, analyzing charts. OET, on the other hand, is designed specifically for healthcare professionals. You'll be dealing with clinical scenarios, writing referral letters. It's familiar territory, and a lot of doctors find it much more manageable. Okay, so once you're through that initial registration hurdle, you'll start looking for your first job. And right here, you face a critical choice, a real fork in the road that's going to shape the very start of your NHS career. So here's the bottom line. A training post is a super competitive, structured program that leads directly to becoming a consultant. A non-training post, on the other hand, is all about providing clinical service and, crucially, gaining experience. For most IMGs, the non-training post is the recommended first step. It is the perfect way to adapt to the NHS, get those all-important UK references, and build up your portfolio before you go and tackle the competition for a training spot. So, you've got your first job, you're finding your feet in the NHS. Now it's time to face what many, many people consider the biggest hurdle of all, the Royal College exams. So what exactly is MRCEM? It stands for Membership of the Royal College of Emergency Medicine, and passing these exams is the benchmark. It's the official stamp that proves you have the essential knowledge and skills to practice emergency medicine at the UK standard. It is, simply put, your key to progressing in your career. Now, the great thing is, they break it down into 3 distinct parts, which makes the whole thing feel much more manageable. You start with the primary, which covers your basic sciences. Then you move to the intermediate SBA, which tests your clinical knowledge. And finally, you have the OSCE, which is a practical exam where you actually demonstrate your clinical and communication skills in simulated scenarios. And remember this number, 6 months. It's what Dr. Farook achieved, passing all 3 of those parts in just half a year. It's an incredible testament to what is possible with extreme focus and dedication. But, and this is a really important but, it's also crucial to be realistic. For most doctors who are juggling studying with full-time work and, life,
The journey to pass all parts of MRCEM typically takes somewhere between 1.5 to 3 years. This is a marathon, not a sprint.
Okay, so you've conquered the exams, the gauntlet has been run. Now the path to the top becomes so much clearer. Let's take a look at the structured career ladder that takes you all the way to consultant.
This roadmap shows you the way. You start in that non-training post to get your bearings. From there, you enter competitive core training for about 3 years while you finish up MRCM. Then, you advance to higher specialty training as a registrar, tackling the final fellowship exams or FRCEM. And the end goal? Earning your Certificate of Completion of Training, the CCT, and becoming a consultant, a senior leader in the department.
So, after all that, what does it actually feel like to work in a UK emergency department day to day? Let's ground this entire journey in the reality of life on the shop floor.
The culture is, well, it's unique. It's incredibly fast-paced, but it's built on this amazing foundation of teamwork with nurses, paramedics, and other specialists. The hierarchy is surprisingly flat and supportive. Junior doctors are absolutely encouraged to ask for help. It's high pressure, there's no doubt about it, but that pressure forges this powerful sense of camaraderie, and it creates an amazing environment for learning something new every single day.
And what about that work-life balance? Well, it's a trade-off. The shifts are intense, for sure, but when your shift is over, it is truly over. There are no ongoing ward duties or clinics chasing you down. This system gives you fixed, protected blocks of time off so you can properly rest, recharge, and actually live your life.
And here's a final piece of advice from our mentor. A career in emergency medicine is a mental marathon. And resilience isn't about being tough all the time or being unbreakable. It's about knowing when you need to pause, when to reflect on your experiences, and then finding the strength to rise again.
So there you have it. The path is clear, the challenges are known, and the rewards are absolutely immense. The only question left is, are you ready to begin?